In medicine, expertise is built one patient, one case at a time. But have you ever stopped to think about what happens to all that incredible, hard-won knowledge? Every single day, thousands of fascinating, truly educational clinical cases are seen, diagnosed, and then they just vanish. They get buried in the digital archives of a hospital, and their power to teach is just lost forever. Well, today we're looking at a new ecosystem that's designed to stop that from ever happening again.
This quote right here is really the heart of our story today. Clinical practice is fleeting. Publications are permanent. It's such a simple but powerful idea. It recognizes that all the valuable stuff from daily clinical work, the subtle insights, the tough diagnostic puzzles, the expert reasoning, it's all temporary. It helps that one patient, for sure. But once the case is closed, without a system to capture it, that knowledge is gone.
So that's the billion-dollar question, isn't it? How do we take those fleeting moments of clinical genius and turn them into a lasting library? A resource that can actually train the next generation of doctors and, push science itself forward.
Okay, so before we jump into the solution, it's really important to get a handle on the problem. We need to understand what's not working with the traditional way medical knowledge is handled, especially in a field as visual and complex as radiology.
Think about it like this. You've got two completely different ways of learning. On one hand, you have textbook learning. It's great. It gives you the what, the name of a condition, the classic signs. But then there's expert reasoning. This is what happens in the real world. It's dynamic, it's practical, and it gives you the how and the why. And that is the massive gap we're talking about. The difference between just knowing a fact and actually understanding how an expert solves a tricky case.
And believe me, this isn't just some philosophical debate. It has real-world consequences. Thousands of incredibly valuable cases are just lost. They're not documented properly for teaching, they never become scientific papers, and what that does is create this huge training gap for residents and doctors. They're missing out on the real-world scenarios they need to see to build true expertise.
It was this exact problem, this gap, that sent neuroradiologist Dr. Leonardo Furtado Freitas on a kind of international quest, searching for a way to finally bridge that divide between theory and practice.
And you can see his journey here. It kicked off in Brazil, then took him to a really prestigious fellowship at McGill University up in Canada, and eventually led him to the US to build his career in Miami. This path wasn't just about moving around. It gave him this unique international view on the challenges that are actually universal in medical education.
So with over 13 years of experience, spread across 3 totally different healthcare systems, he kept seeing the exact same problem everywhere he went. Priceless clinical knowledge was just constantly being lost. And all of that experience laid the groundwork for a pretty radical new idea.
And during this journey, he had one of those aha moments, an epiphany really, that had the potential to change the very way we think about passing down medical expertise.
This was the big idea. It sounds simple, but it's a profound shift in thinking. What if clinical cases weren't just gone after they're diagnosed? What if they could become the raw material for a permanent, living, breathing library of knowledge?
So that idea didn't just stay an idea. It became the core mission for a brand new platform. A whole ecosystem designed not just to show you cases, but to actually preserve and transfer the expert thinking behind every single one.
So, let me introduce you to NeuroRad Advisor. You can think of it like a collective clinical brain. It's designed to capture all those little nuances of diagnostic thought and make them accessible to anyone, anywhere in the world.
And this right here, this is the core promise. This is what it's all about. It goes way beyond the simple static answer you'd get from a textbook. The focus shifts completely to the dynamic, step-by-step process of actually reaching a diagnosis. It's all about deconstructing expertise so you can learn it.
So how does it actually do that? Well, it essentially creates a virtual apprenticeship. You get access to this incredible personal archive of over 13 years of real clinical cases. And the magic ingredient is that for every single one, there's an audio commentary from Dr. Leonardo himself, walking you through what he saw, what he ruled out, and exactly why he made his final call. It's literally like having a mentor standing at your side for every case.
The whole process is built for active learning, which is key. First, you get access to the archive. Then, and this is the important part, you analyze the case yourself, come up with your own opinion, and then you listen to the expert audio commentary to see how your thinking compares. And with new, challenging cases being added all the time, the learning just never stops.
And this isn't just a cool idea or a concept. This is a new learning ecosystem that is already making a huge impact on doctors all around the world, right now.
I mean, look at this. Doctors, residents, fellows, they're joining this community from every corner of the globe, from the US and Brazil to France and Nigeria, all over. They're all tapping into this one centralized library of expertise.
And the feedback, well, it really speaks for itself. For fellows like Dr. Sarah Mitchell in the US, it's all about building confidence by getting exposure to this massive, incredibly detailed library of real-world cases.
For a resident like Dr. Rafael Mendonça in Brazil, the game changer is that audio commentary. He calls it a private preceptor available 24/7. I mean, can you imagine? That's direct, personal mentorship anytime you need it.
And then you hear from experienced consultants like Dr. James Okafor in Nigeria, and he sees it as something even bigger. He says this is the future of radiology education because it gives you that real clinical context that textbooks just can't touch.
So this leaves us with a pretty provocative final thought. Okay, this model is working for neuroradiology, but what if we scaled it? What if this was applied across all of medicine? What if every single interesting case, seen by any expert, anywhere in the world, could become a permanent lesson for everyone who comes after them?
Because the goal of an ecosystem like NeuroRad Advisor isn't just to archive the past. It's about building a smarter future. When you transform that temporary, fleeting clinical practice into permanent, accessible knowledge, you're not just training better doctors. You're building a library that's constantly growing, constantly preserving our most valuable medical insights for generations to come.